Miami Dolphins quarterback Tua Tagovailoa speaking out for the first time since his concussion and reveals something that we are just learning.
I wouldn't say it was scary for me at the time, because there was a point where I was unconscious, so I couldn't, really tell what was going on.
Well, Tagovailoa says he remembers being taken to a hospital in an ambulance on September 29th when the Dolphins lost to the Bengals, but not much else. He said he needs to learn to accept that a play is dead. He hit his head on the ground in 2 consecutive games when he was tackled. He's been cleared by doctors and plans to start Sunday night against the Steelers. Well, those back-to-back concussions sparked widespread criticism of the Miami Dolphins and the NFL, eventually pushing the league to update its concussion protocols. Now players won't be allowed to play and be back on the field if they appear off balance or have slurred speech, but some say the changes don't go far enough to protect the players. Joining us live this morning to discuss all of that is neurologist Dr. Wang. Good morning, doctor. Thanks for joining us.
Good morning, Mark. Thanks for having me on.
Well, let's start off here with Tua's incident. It sparked wide criticism, eventually led to a review of the league's policy. What happens when you get a concussion, let alone 2 so close together?
So a concussion is basically a clinical diagnosis. There's no single blood test. It's basically an end result of having a traumatic force to your head that suffers from dysfunction to the brain and symptoms. Now, symptoms from a concussion can vary widely. You can have difficulty walking, as in Tagovailoa's case, or you can have nausea, you can have ringing in your ears, difficulty concentrating, difficulty focusing. These are all symptoms from what we normally term as a traumatic brain injury or some kind of trauma to the head. And a concussion generally is a mild traumatic brain injury.
Yeah. So
now, the thing about...
Go ahead.
So in terms of Tagovailoa's case, he had suffered 2 concussions back to back. And this is what we commonly term as a second impact syndrome, where you haven't fully recovered from the first concussion before you have the second one. And that second concussion can result in a much more severe degree of injury than compared to the first one.
So, Dr. Wang, how can you tell when someone has had a concussion or simply just a hard hit?
So oftentimes, like I said, there isn't a single blood test, although that's being currently researched. So you just really have to pull the player aside. And in sports, for example, they have what's called the Sport Concussion Assessment Tool, or the SCAT, and it's just a checklist of symptoms. Do you have a headache? Do you remember what the current score is? For example, in athletes, who scored the last goal or the last touchdown? And you run them through basic neurologic exam. Can you walk in a straight line? Can you balance properly? Do you still have dizziness? Things like that. And if they don't have or if they don't pass any of these tests, then essentially they're diagnosed with a concussion and they should be pulled from the game and not allowed to be returned.
So the new protocol also adds ataxia to its list of no-go symptoms when deciding when a player can get back on the field. What is it? What does it look like?
So correct. So before this, ataxia was not listed, and after this, the NFL updated their criteria. And ataxia basically just means uncoordination. And this is not the uncoordination where I can't juggle 3 balls, but a profound degree of impairment, such as if you go back and watch the game footage from the Bills game, he had stood up actually and started walking and then was not able to walk in a straight line. He stumbled and almost fell and had to be helped out by his teammates. So it is a profound degree. And it's not just difficulty with walking, but you can have slurred speech, difficulty with fine movement control of your hands, such as brushing your teeth or feeding yourself.
A wide range of symptoms. How long does it typically take to recover from a concussion? Is there a set answer there? And what do you look for to determine that?
That's a great question. And so there is no great way to determine. Some of the common things we go by is the degree of injury, if you lost consciousness from the event, and if you have any pre-existing health conditions. Now, typically, recovery on scale of weeks to months. Some patients even have prolonged concussion symptoms months out, and we call this post-concussion syndrome, not unlike, for example, long COVID. Even in the most top-performing athletes, such as NFL players, the average time to return is somewhere around 9 days. So it is not something where you can just quickly bounce back from typically.
Yeah, let me throw in this. Are you surprised that Tagovailoa is going to be back here for this game this weekend?
He has passed the protocol, so I will leave it up to him. Part of this overall trend is what's balancing player safety versus practicality. Every player wants to play and get out there and compete, but you have to also think about what's best for the players' lives and their brain health at the end of the day in the long run. So it is a personal decision as well as what's best for the game.
Sure, and so many people watching, of course. Neurologists have been warning for years about the threat of CTE. Can you briefly remind us what it is and if there's any way to lessen an athlete's risk?
Sure. So CTE is otherwise known as chronic traumatic encephalopathy. And this is basically a unique disease. We've actually known about it for about 100 years now. We used to call this boxer's dementia. And it is a unique disease separate from anything else that we've seen before. Right now, it's only diagnosed upon autopsy. So, not the best ideal way. And it's a result of repeated blows to the head. The important thing about CTE is that you don't necessarily have to have a concussion. There have been soccer players diagnosed with CTE who've never shown concussion symptoms. And so the sort of alarming thing is that because you never have to have a concussion, you may have CTE and not really realize it if you've played contact sports. So it just goes to show you that there has to be, balance between safety and practicality in the long run for competitive athletes who are engaged in any kind of contact sport.
Yeah, so on that note, before we let you go, polls show that Americans overwhelmingly agree that the NFL needs to do better when it comes to protecting players from long-term brain injuries. In a perfect world here, how might you suggest the game's rules be changed, if at all, to mitigate those lifelong injuries?
Well, this is the hard question. They've updated their helmets, they've updated their concussion protocols many times. At the end of the day, these are contact sports where you take hits and blow to the head. So, as we learn more about the science, and there's been latest research regarding, just how much force there is to cause a concussion. And so, there's going to be an active conversation between the NFL and the NFL Players Association about what is best safety, what is, the amount of force, what should be the requirement to remove someone from a game. It's going to be a lot of ongoing discussion. I don't have a clear answer. It's going to be just sort of dependent on case by case, such as in Tagovailoa's situation, where they update as new cases arrive.
Sure. Okay. Well, it's a huge topic. Again, so many people watching, all forms of sports, not just the NFL. So, Dr. Wang, we appreciate your expert medical insight on this topic this morning. Thanks again.
Thanks for having me on.